second talk presented by Dr. Heba under the title of Effect of Applying an Educational Program for Patients with Lumbar Discectomy on their knowledge and self-care activities. اتفضلي يا دكتورة.
شكرا طبعا ان انا ان شاء الله موجوده معاكم النهارده. Effect of applying an educational program for patients with lumbar discectomy on their knowledge and self-care activities. Lumbar disc disease is one of the most common spinal disorders worldwide. It contributes significantly to healthcare costs and burden of disability. Lumbar disc herniation exists on a continuum of degenerative spinal process that frequently affect the spine in young and middle-aged patients. These include intervertebral disc degeneration and lumbar spondylosis. Lumbar disc prolapse is a degenerative disorder of a spine in which tear in outer fibrous ring of intervertebral disc allows the soft central portion to bulge out beyond the damaged outer ring. Despite continued advances in operative technique, significant number of patients fail to achieve pain relief and endure multiple follow-up treatment in an often futile attempt to alleviate their everlasting discomfort and suffering, such as patients are diagnosed as full back surgery syndrome. On the other hand, recent study proved that most patients with low back pain respond well to conservative and complementary therapy, and only 1 to 2% of patients require surgical intervention. The most common type of surgery are laminectomy and discectomy. Laminectomy is a surgical procedure to remove posterior arch of vertebra. It is performed to relieve pressure on a spinal cord or nerve root emerging from a spinal canal, while discectomy is performed to decompress the nerve root. This microsurgical technique that uses a very small incision through which the herniated intervertebral disc material is dissected and extracted. It has two types, percutaneous laser discectomy and microdiscectomy. Self-care was described by Oram as one of the modules of self-care nursing philosophy. The value of self-care conception is linked to human need to preserving, supporting health and recovery. Absence of healthcare education, insufficient access to health facilities for a whole community, and improved expenditure of healthcare service, self-care educational action, improve symptom, reduce complication, shorten recovery, and decrease hospital stay and rehospitalization rate. The nursing care of lumbar disc prolapse surgery patient include nursing assessment, starting from assessment, intervention, monitoring, even pre-operative and post-operative, and then completely as discharge instruction to be completed after the patient returns to his home. The present study aimed to evaluate the effect of applying educational program for patients with lumbar discectomy on their knowledge and self-care activity. Hypothesis of this study, knowledge of the studied group will be improved after applying the educational program than the control group. The study group will be able to perform self-care activity on their own after applying the educational program than the control group. A quasi-experimental design was used in this study. This study was conducted at the Neurosurgery Department, Alexandria Main University Hospital. A convenient sample includes 50 adult patients diagnosed with lumbar disc prolapse and scheduled for discectomy surgery, and the total number is divided into two equal groups, 25 each. Exclusion criteria include physical and mental handicap, disoriented and comatose patient, patient on mechanical ventilation, patient with hemiplegia or quadriplegia. 3 tools were used in this study: patient assessment sheet, knowledge assessment questionnaire, and personal index of activity of daily living. The first tool consists of 2 parts: biosociodemographic data and clinical data and patient health history. Tool 2 include 45 closed-ended questions to assess patient knowledge about the definition of lumbar disc risk factors, sign and symptom, postoperative precautions, postoperative exercise, and postoperative complication. The personal index of activity of daily living, this tool used to assess the patient's ability to perform activity of daily living, and it including 10 categories, which include bowel, bladder, grooming, toileting, feeding, transferring, mobility, dressing, stairs, and passing. and each category is categorized to completely dependent, need assistance, or independent. The study was conducted according to the following steps. Official letter was obtained. The tool must be submitted to 5 experts in neurosurgery and medical surgical department. Data collected throughout period from March to August 2020. Reliability of the tool must be used using Cronbach alpha test. Pilot study conducted on 5 patients and developing of educational program. Educational program starting with preparatory phase, starting from preparing the educational material to applying to the patient. Assessment phase including biosociodemographic data and the clinical data and all assessment about the knowledge of the patient. Implementation phase starting the educational program and evaluation phase to assess the patient knowledge and the patient compliance about compliance of educational program. This is example of education given to the patient, including definition of disc prolapse and manifestation of lumbar disc prolapse, risk factors, preparation of the surgery, post-operative nursing care, starting from fasting and detail to using body mechanics, post-operative exercise to decrease the post-operative pain, post-operative warning signs that may returning again to the doctor. Evaluation phase, this is occurring post-operative on the 15th days post-operative, reassessment of the patient using tool 1, comparison of the pre- and post-operative disc surgery presence of problem, post-operative and the post-operative compliance of the patient with educational program, satisfaction and patient assessment, reassessment of pain. The result of this study, distribution of a studied patient according to sociodemographic characteristics. Regarding the patient age, the highest percentage of patients of both study and the control group were among 30 to 40 years old. As regarding the gender, the highest percentage of control group were female, while in the study group were male. The majority of the patient in both group marital status had married. According to occupation, the majority of the patient in the control group were housewife, while in the study group were laborer. In relation to educational level, the majority of the patient in post-study and the control group were illiterate. As regarded to the area of residence, the highest percentage of patients in the control group were from rural area, while from the study group were from urban area. Distribution of studied patients according to medical data. The majority of the patients in post-study and the control group have chief complaint were low back pain and sciatic. As regarding the prescribed medications, the majority of the patient in post-study and the control group had intake muscle relaxant and painkiller analgesic. Severity of low back pain for patient in the control and study group in relation to statistically significant difference of pain score was detected in the studied group in the 3rd and 15 days post-operative. Mean percentage score of knowledge of lumbar disc prolapse patient in the control and the study group. Statistically significant changes in knowledge percentage score were elicited in the study group post-educational program than before as regard meaning, predisposing factor, manifestation, post-operative precaution after lumbar discectomy surgery. Post-operative study patient compliance with educational program. The majority of studied patients had complied with educational program regarding post-operative sign and symptom of complication, simplicity of information, and overall improvement following compliance of educational program. Post-operative patient satisfaction with provided educational program for post-study and the control group. There were highly statistical significance changes in satisfaction percentage score were obtained in the study group patient post-educational programs than before. Distribution of patient both group study and the control group regarding their overall parcel index scale pre and post program. This figure illustrated that there were marked improvement in the study group regarding parcel scale of activity of daily living from 33% need assistance program implementation to 100% independently post program implementation. This study concluded that providing an educational program to the patient had been shown to be effective in improving knowledge and self-care activity. Study group had marked improvement in satisfactory level of knowledge post-program compared to control group. Statistical significant difference were found between study and the control group post-program implementation regarding pain severity. Statistical significance difference were found between study and the control group post-program implementation regarding all items of Purcell index. This study recommended that the developed booklet with colored picture involving instruction of self-care activity must be distributed for each patient undergoing lumbar disc herniation surgery in the neurosurgery department and outpatient clinic. Nurses should be aware by instructions that given to the patient before discharge and inform the patient about them to improve their knowledge and self-care activities. A family member or the patient should be taught post-operative precaution and exercise in order to improve patient outcome post-operative and self-care activities. Thank you so much.
شكرا دكتورة هبة. طبعا انت ما شاء الله عليكي خبرة في هذا المجال، بس برضو هل بعد العمليات دي يعني الريزلت بينت ان فعلا في statistical significant بعد الاديوكيشنال بروجرام؟ انا بتكلم على السيلف كير اكتيفيتيز، هل فعلا انت من خبرتك هل اتحسنت من الاديوكيشنال بروجرام اونلي، ولا في اديشنال فيزيوثيرابي؟ البين سيفيريتي بيبقى برضو بعد العمليه ازاي يعني؟
بص يا دكتور، هو السيرجري عامه بتقلل فعلا السيفيريتي اوف بين، ولكن السيفيريتي اوف بين مش هيفضل البيشنت طول الوقت واخد انالجيسيك، ولكن الاكسرسايز جاست ان البيشنت بيعود نفسه على اكسرسايز معينه بحيث ان المسلز تاخد التون والحركه بهذه الطريقه، بيبتدي البين يقل واحده واحده مع الوقت. هو هتبقى دي واحده من الهابتس اللي بيعمل ان هو ازاي يعمل الاكسرسايز. ايفن حتى لو انا علمته بس بادي ميكانكس، يعني انا كان البيشنت بتوعي جاست ان انا اعلمهم ازاي يقعد ازاي يمشي بادي ميكانكس، دي كانت بالنسبه لي حاجه سيجنيفيكانت انه ازاي يقعد، لان معظمنا طبعا البادي ميكانكس بتاعتنا مش حلو. فجاست ان البيشنت تتعلم يعمل البادي ميكانكس معايا، دي بالنسبه لي كانت سيجنيفيكانس ديفرنس، وده الحمد لله ظهر وانا بشتغل مع البيشنت.
كان على وقت قد ايه كده؟ بعد فتره قد ايه؟
يعني من بعد الاكسرسايز اللي انا علمتها لهم في حدود، لان طبعا في اول حوالي ما بين 15 ل3 اسابيع بيبقى لسه في سيفير بين.
اكيد
احنا ابتدينا يعني الشغل بتاعنا بدا تظهر الافكت بتاعه ما بين يعني 5 اسابيع لحوالي 12 اسبوع. بدا البيشنت يتعود واحده واحده ازاي يعمل الاكسرسايز وازاي يستخدم البادي ميكانكس صح.
تمام، الله ينور. شكرا. في حد عنده اسئله؟
شكرا دكتوره هبه. وهو ده طبعا كان التارجت بتاعك، ان هو يعني تبقى زي هابت هو البودي ميكانكس بتاعه كده. وفعلا زي ما انت قلتي كتير مننا في قعدتنا حتى العاديه بنقعد باعداد بطريقه انا ببص كده يعني دي تدمر اي فيرتبرال كولوم او تعمل اي مشاكل هيلث بروبلمز يعني. ثانك يو سو ماتش دكتوره هبه. اوكي اتفضلي.
السلام عليكم. تسلم ايدك. البوينت اللي انا عايزه اقولها، وانت بتعملي انستراكشن او جايدنس للبودي ميكانكس، هل زودتي حاجه عن الهيومن تاتش وانت بتعملي السمايل تشجيع؟ هل في حاجه فرقت من بيشنت لبيشنت ولا جاست انستراكشنز؟ وهل هي كانت مكتوبه ولا في كمان الهيومن تاتش البيرسونال ثينك ذات elevate وبتدي انرجي للبني ادم اللي قدامك؟ ثانك يو.
هو انا اقدر ارد على حضرتك السؤال ده كلمه واحده بس. انا كنت معروفه في المكان دكتوره هبه بتاعت العلاج الطبيعي، يعني ده كان اسمي كده في المستشفى، دكتوره هبه بتاعت العلاج الطبيعي. يعني انا طول الوقت ماسكه البيشنت بحركه في الكوريدور، لا اقعد صح مش عارفه ايه طبطبه لا ظهرك كده وجعك. يعني انا كنت بحاول اخد حته من التاتش اللي بعملها مع الستودنت، اخبط مثلا بالراحه تابنج كده على ظهره، لا القعده دي غلط هتوجعك، طب ايه رايك نقعد صح، حط له مخده صغيره مثلا في الكيرف بتاع الظهر، ايه رايك في القعده دي؟ فبدا البيشنت من هنا، خاصه ان هم كانوا معظمهم هاوس وايف، لا ده انا كده، ده انا طول الوقت شايله ابني ومش عارفه بشتغل فين وطالعه نازله. فبدات الحته دي بدات لا توصل لهم، لا خلي بالنا احنا كده دكتوره هبه العلاج الطبيعي لا قالت لي كده غلط، كده انا هيجي لي وجع. فمع الوقت بداوا فعلا يتعودوا على الحته دي.
يعني هل بيختلف من خلال شخص لشخص في البارت ده؟ يعني هل في ناس محتاجه بوستر دوز من الكومفورت من طريقه كلامك من الطبطبه، ولا كانت
بين الميل والفيميل، لان الميل معظم وقتهم بره الشارع، خاصه اللي انا قابلتهم كانوا كلهم اللي هم بيشتغلوا في الفاعل، اللي بيشتغل سواق فطول الوقت قاعد تقريبا 3/4 اليوم، فدي كانت لا انا عامله بوستر دوز مع الكلام، لا خلي بالك الحته دي، طب نفصل شويه في السواقه، طب مثلا انت شغال 12 ساعه، لا هنقعد مثلا هنطلع نشرب شاي بس مش هتقعد على القهوه، تخليك واقف بحيث ان انت تدي الريفليكشن والالاستيسيتي بتاعه الفرتبرال كولوم عشان ما يبقاش طول الوقت واخد البوزيشن بتاع السكين.